Welcome to today's discussion, Defending Healthcare Perspectives on Cybersecurity and Medical Imaging. Thank you so much for joining us today. These are Merge's disclaimers on forward-looking statements. Presenting today are three experts from the Merge team representing different functions to provide diverse but related viewpoints on the subject of cybersecurity and imaging. I'm pleased to introduce Dr. Raj Chopra, Merge's Chief Medical Officer and a practicing radiologist, Scott Sipple, our Chief Information Security Officer for Merative, and Nilesh Shah, Chief Technology Officer and Head of Engineering. I will hand it off to Dr. Chopra to begin the discussion.
Thanks, Sean, and thank you everybody for coming. Our topic today is healthcare is under attack. How do imaging organizations prepare and defend? And I think it's interesting to have a radiologist start off the conversation because we're oftentimes not the focal point or who you think about when there's an IT disaster going on. But oftentimes we are the face of the problem when it's occurring. Sean, next slide, please. In this discussion that we're going to have, I'm going to take the role or the lead on the industry perspective. And when I think of industry perspective, I think of radiology, of imaging industry perspective. So I'm actually going to be giving the clinical background on what happens when a cyber attack occurs. What are the issues that need to be dealt with at that time when we are going through that event, and the clinical impact that a negative cyber attack has on an organization. Next slide, please. So cybersecurity, it's a huge problem, and we all know it. The reason why healthcare organizations are affected most often is because we're where the information is at. If you're going to create, a new person, or you're going to create havoc in the financial industry for a person, we have all the required information that cyber criminals require to create an identity that can be used for, financial mishap. On top of it, we're also where people think we're an easy target for ransomware and other items, where the information that we have is so critical to the care of the patient that they know that they can hold us hostage and push our buttons because we get so worried about our patient care that we're almost willing to do anything. There's been a huge cost for this problem, and we know that. Healthcare spending on cybersecurity has dropped slightly, but that's only because we've paid attention to it in the past, but it's continuing to be a huge problem. So I find a lot of these topics or these statistics very interesting. The average time to identify a breach is 194 days. To contain a breach is 64 days. So it's a long-term problem that when it occurs, it heavily affects us. The most interesting thing on this slide to me is the inpatient mortality rate. It actually rises during a ransomware attack. And that's because the critical information that we need in order to perform the duties that we have is missing. And so we talk about the financial impacts, but there's a true human impact that oftentimes gets forgotten about. And it's so large that it's very scary. And these things need to be thought about whenever a quote unquote IT problem occurs. On top of it, there's also a real impact on the speed at which we can give care, right? Hospital volumes drop during the first week of a ransomware or a cyber attack because we can't give information or communicate fast enough when these type of attacks occur. Next slide, please. And the other thing that cyber attacks really point out and really highlight is the interconnectedness that all of our different hospital organizations really have. None of us live in a silo. Patient care has become a team sport, not only within the hospital where there's a multitude of different types of physicians working on the same patient, but even between hospital systems within a city, or, we transfer patients from our hospital system to a tertiary care facilities and vice versa. And that care of the patient has a ripple effect. So even though my hospital may be the one that's undergoing the cyber attack, the other hospitals in the system will for sure be affected. Not only that, we're all busting at the seams with patients right now. And if a particular hospital has to go on bypass, which nobody wants to do, but because of a cyber attack may have no choice to do, the other hospital census will rise. And there's just not enough physicians. There's not enough infrastructure for that kind of thing to occur. There's just not enough redundancy in the system for when a cyber attack occurs to be able to not be impacted by this. Again, I want to highlight that mortality rate increase, which is shocking to me. So it's not just a computer issue, right? So much of healthcare is now based in the digital world. Information transfer between docs is key so that patient care is seamless. It makes sure that that the information that I have obtained, the lab has obtained, us in radiology, what the ER docs are putting together, what the specialists are seeing, the interconnectedness there inside of a hospital is super key too. So, cybersecurity and cyber attacks have a multifold effect. Next slide, please. So, just in summary of what I've said so far, there's a disruption to clinical operations, there's stress from a lack of communication, and there's frustration to maintain patient safety and outcomes. One of the things that I like to talk about, and oftentimes is forgotten, is that when a cyber attack occurs, yes, it is an IT problem, but the face of the problem is oftentimes the physician sitting at the site, and that could be a radiologist. So there's frustration that occurs because of the patient not being able to get the care that they expected. Maybe they took time off from work to get the scan that they wanted to get or needed to get. There's the clinicians on the other end that are waiting for reports that can't, figure out the next step in patient care or possibly can't schedule a surgery. There's your own staff within the imaging center who can't maybe check in patients or get the patients through the scanner quick enough. So there's a multifold problem that arises, and we're sitting at the center of the storm. And clinicians need to have, or radiologists need to have, all the most up-to-date information that's out there so that we can calm nerves, calm frustration, and give information as timely as we can. There's been, I've actually experienced a cyber attack in my institution that had a profound effect on us. And when that cyber attack occurred, we were kind of put in the dark. The vendor that we worked with, instead of communicating with us, spent a lot of time, I think, internally trying to figure out the problem without telling us, the timelines and what was happening on their end. And that lack of communication really had a frustrating effect for us, because when people came to us for, hey, when are you guys going to be back up? I need this information for the surgery this afternoon. Do you think should I cancel the surgery? What should I tell the patient? All those questions we couldn't answer because our vendor couldn't answer them. So that when I talk about frustration is key to communication. So if there's lack of communication, that frustration rises. And as vendors that, most of the time work seamlessly in the background to provide service to our doctors and to our health systems, that communication is key, and it can't happen after the event has occurred. We, as a vendor community, need to have a plan in place before that event occurs so that we're ready and know what to say, and we can hold the hand of the doctor and the IT administrators on the other side that are our clients so that we can guide them through the process. Next slide, please. So this goes back to what we talked about before, the interconnectedness of patient care at this point in time. An average of 5 to 7 healthcare workers are involved in average patient visit with the emergency room. We know that's true, right? But radiologists are key to that care pathway these days. The ER physicians are so busy. They're seeing so many patients. There's so many people coming through, and that results in a lot of imaging being done. And what we say and how we help our ER colleagues is key so that rapid patient care can occur, so they can triage and the hospitals can do what they do to make the patient feel better. And, that means, do we admit the patient? Are we sending them up to the floor? All of that interconnectedness is digital these days, or at least so much of it is. And poor communication resulting from a cyber attack can have a crucial impact on all of that care. As we said before, communication is crucial for continuity in patient handoffs and steps in care delivery process. Knowing what is happening allows healthcare professionals to plan and decide the effect of an outage. So that goes back to what I said. If I, as the center of the problem, if it is a radiology IT outage, need to be informed by my vendor so that I can guide or my own staff, and I can let the ER physician or the surgeon know what the next steps are. Do they need to go on bypass? Do they need to let the other hospitals know? Can they perform certain tasks in a different way so that patient care can continue? All of that has to happen. But in order for me to help in that process, the vendor that is having the cyber attack that is causing the issue that I'm being affected by needs to communicate with me. Next slide, please. So there are other industries that have downtimes. Healthcare is a little bit, in my opinion, behind where we need to be that other industries are. And it may be because maybe we don't have as many issues like these other industries do. We all have flown, and we know that they have outages and downtimes pretty consistently. We remember what happened with Southwest a couple years ago. They are better at communicating. The one that I use as an example most often is I'm in California, and we have a utility by the name of PG&E. And there was a period of time where outages were a regularity. And I don't want to, jinx it that it might go out right now as we're speaking, but they may not know the electricity game well, but I was kind of impressed by their communication standards. When we lose power here, I get an alert both on my text messages and by email, letting me know that they acknowledge that there's a problem going on. Then they give a update a little while later saying, hey, we're at the site. We think it's going to take this amount of time in order to fix it. And then after that period of time, say it's an hour goes by, they give you a follow-up text message saying, hey, we've been working on it. We actually have an update. We think it's going to take 2 more hours. And then that continues on until the problem is solved. And then they send you a text message telling you that the problem is solved. That level of communication may seem redundant or overdoing it. But when my wife comes through the door to ask the question of when our power is coming on, I have something to show her. And, I'm being a little cheeky about the subject, but I think it's important for us as a vendor community when an outage occurs or when cyber attacks occur that we provide as much information as we humanly can. We need to acknowledge that there's a problem. We need to let them know we have experts working on the problem. Once we know what the problem is, give a timeline as to when we think the problem will be solved, and walk them through the process so that when they're the center, when they're the lightning rod of all the problem and frustrations that are occurring around them from their own staff and other doctors and patients, they have something to say. And that is key during IT and cyber attacks, is that piece of communication, that letting the person on the other end know that you're in the trenches with them. And that draws a level of trust that will, flow over into other items that when you work with the vendor, that that they're on your side. And that trust is key for them to stay with you even after the cyber attack or the IT outage has occurred. So I really, implore the vendor community. I implore my own company to have a plan, to sit next to the radiologist or the clinician or the IT administrator that is taking on all the frustration from the people around them so that they're ready when this type of event occurs, because we know this event will occur, right? We're where the information is located. We're where the cyber criminals want to hit. We're a high value target. So without having a plan in place before all of this happens, we're going to be really doing a disservice to our customers. Next slide, please. This slide is a little complicated, but what it's trying to tell you is that the cheapest and the most achievable way to be prepared and to innovate for a cyber attack is to create communication channels, to have your plan in place, the communication plan in place before any of this happens. And there's a lot of stuff on this slide. You can see all the other areas that we need to work on in cybersecurity and the associated costs and achievability. But we as a team and as a community need to focus on that communication piece. Next slide, please. So moving forward, in today's world, to support clinicians, health technology innovation must prioritize these three things. We look for best practices. We don't have to create and innovate the wheel. There's other organizations that have done it, but we just need to adapt it to our needs. And we need to continue. Number two, prioritize communication needs of the end user. Don't forget about all of us that are going to be the face of the problem. When clinicians are frustrated and patients are frustrated, we're the ones who are going to be the lightning rod of that. And when a communication plan is put in place, I hope you think of that so that you don't leave us on a pedestal alone. And then consider downstream effects, give visibility and control back to clinicians. So yeah, the interconnectedness that we live in, how much we work with other doctors and other healthcare systems to provide care to complex patients these days. Without the communication and understanding from the vendor telling us what's happening, that intercommunication, the interconnectedness breaks down and has huge effects on mortality. So thank you. Appreciate your time on this one. My colleague Scott will be focusing on the next perspective, which is more, they're the smart guys. They know the IT part, the inner workings of how this all goes. Scott, to you.
All right, thank you, Dr. Chopra. So what have we learned regarding cybersecurity attacks? Next slide, please. That PHI data is vulnerable, and there's an inherent need to share it across the ecosystem. This increases that attack surface and widens our exposure to the bad actors and what they're looking for. Protected health data is always under constant attack, and unfortunately, I'm alerted to security events in healthcare far too frequently. Managing this risk can be challenging as legacy infrastructure doesn't scale well to address security. It's often not easy to address or cost prohibitive to replace. So in response, we really need to ensure our organizations are committed to the discipline of security and protecting against these attacks. We must also adapt and build on what we learned from previous events and ensure there's a focus at multiple levels, like the products, infrastructure, cloud, enterprise assets, suppliers, everyone in the ecosystem. For events like Snowflake or attacks against weak authentication, or the implementations of how we, log on to these systems, we need to be very transparent on the responsibility when it comes to all the parties involved. And you've been hearing a lot about communication, and that is key. It's important, right? Throughout the ecosystem, you need the communication of all the parties involved, from sharing threat intelligence to managing the actual events, where having that accurate and up-to-date information is important for execution, mitigation, and the recovery. It really makes a big difference in the outcome. But another thing we've learned about that, right, is as CISOs or security teams, we want to get a message out, but we have to be careful on that message. We get entangled with legal as to, am I ready yet to send, this agreed upon message to our suppliers or everyone's going on, because they need to know, but we always like to control that message when we're working with legal. So that is a challenge, and we're working to improve on, especially within the ecosystem, having that trust in place that we communicate quickly as to events going on without that concern. And back to weak authentication. What did I mean about that? Well, sometimes maybe you only have one second factor and it's SMS and it's weak authentication, right? I'm going to talk a little bit more on the next slide as what we're doing at Merative at the enterprise level on authentication methods. Next slide, please. Thank you. So at Merative, what we're doing is we're following the NIST cybersecurity framework. And it covers these areas of identify, protect, respond, recover. And when we talk about identify, this is where I get to live in both sides of the fence, right? Third-party risk management. Everyone here as our customers, right? I'm always responding to security questionnaires, or what are we doing about security, or providing reports on SOC or HITRUST or ISO, right? But I'm also doing that with my own third parties as well, looking for the same things you're looking for in us. What we've seen a new trend in is security risk services that are out there. Like Risk Recon or BitSite, where they actually go out and score these companies that are out there in any of the different type of marketplaces, right, that exist. And some of them go beyond just scoring and actually scan or scour the dark web and actually give reports and findings that, you know, as your supplier, we have to respond to. Have we addressed? Have we mitigated? Is it something that you know, has existed for a while and hasn't been remediated yet? A lot of these services are finding these things that we wouldn't normally do. I'm leveraging them as well as we assess our own third parties. Another area that we've spent a lot of time on in recent years is threat intelligence, right? So we have this thing we call events of interest. So if one of our customers or someone else close to us in the industry is having a cyber attack, we'll consider that something of interest, and we'll start to investigate. What are we seeing in the media? What do we know about the threat actors? Is it something we can learn? Do we need to mitigate against it? Is it something we could be impacted by? So we have a threat intel team that always builds a case on what's going on out there for what we've seen. When it gets to detection, Merative does have a 24/7 security operations center where we're monitoring everything across our states, including our cloud solutions that we provide to our customers. We also internally are making sure we protect our data with other tools like Purview that comes from Microsoft that allows us to detect against data loss protection, either within our email or in our Teams chats or other solutions that we're using to exchange information either internally with each other and other third parties. When it comes to protection, we're using the Microsoft stack of features, right? Defender is used across many Microsoft tools. It is our endpoint protection. It feeds into our log aggregation tools that collect in the Microsoft space, tells us everything about our cloud solutions in Azure from what our end users are doing. As we get to, and as I talk about weak authentication, right, that we're leveraging Entra ID. We have this thing called conditional access where I can only access Merative and Merge resources from one of our managed assets. I can't do it from a personal device, whether it's how we're administrating our cloud solutions or accessing our email. In addition to that, Entra ID is giving us real strong multi-factor tools that we can work with, things called phishing resistant authentication, where even with multi-factor, you can be at risk of getting phished and having your credentials compromised. We're looking at better ways to do that and even getting more to the point where we can be passwordless with other secure mechanisms with Entra ID. When it gets to response, right, we have many tabletops each year on how we do instant response, either if it's for business continuity, disaster recovery, or cybersecurity incident response. Anything that we see that comes in, if it's a threat, see something, bring it to our CSIRT team. We'll investigate it. Maybe it's an event of interest, things that we're going to look at as to how we manage our whole estate and see what's going on across our customer base and our third parties as well. Now, with that, I'm going to lead you to Nilesh. He's going to take a product perspective on cybersecurity as we move forward. So, Nilesh.
Thank you. Thank you, Scott. Building upon the NIST cybersecurity framework at the enterprise level, we now focus on the cybersecurity framework at the software level. This is the layer with the most data touchpoints in the ecosystem. So at the software solution level, a good model to look at is the medical device cybersecurity lifecycle management model by Health ISAC. Health ISAC is a global nonprofit member-driven organization focused on cybersecurity best practices. This model is aligned to the new FDA cybersecurity guidance. And based on this model, we have chosen to create policy around 4 major areas of product security: the pre-market, post-market, supplier management, and customer engagement. And you heard about a lot of this at the enterprise level from Scott, but we really need to take those same principles and apply it at the product security level as well. On the pre-market side, it's focused on integrating security by design into the product development using CIA triad of data production: data confidentiality, data integrity, and data availability. Applying these principles, we incorporate security into the software architecture, constantly review them. Every revision you want to make, every new service you want to integrate, every new service you want to build, all of that, you constantly look at the software architecture and risk potential of the architecture and incorporate those changes for security posture, better security posture into the design. And you also include the evaluation of threat while you are doing development. So you can do the static scans, you can do the dynamic scans of your test system or your production system repeatedly, and you incorporate those into your software development process. And this is how you make sure that every software version release is as secure as it can be. The post-market is your software is running, customers are using it, but the job of monitoring for security, looking for security does not end. You have to continue doing that. And so for that, we use the tools that Scott talked about. And this is where we have to continually do threat monitoring. Vulnerabilities are discovered and exploited daily, from network software to operating systems to development frameworks and library components, which constitute most of the softwares that we run. We have formalized and constantly evolve a process that assesses the security and patient harm risk of known vulnerabilities associated with any technology component used in the products. And then you have to address them appropriately as quickly as you can and make it part of your software development process, where every change, every version you are thinking about, besides considering the enhancements, new features, you look at the technology debt, you look at the security debt, you look at the known vulnerabilities, and you try to address them as quickly as you can. The third aspect of it is supplier management. And this is essentially, you are only as strong as your weakest link. So we have to incorporate the same security rigor into the supplier management process for both services as well as software. And the diligence needs to extend to open source software as well. And this is an important aspect because open source software usage is prevalent and very widespread in most software development and solutions. On the customer engagement side, it's all about two-way communication. Dr. Chopra touched on this from the vendor point of view, from the radiologist point of view, the face of the crisis point of view. That is really important to keep in mind. So on the customer communication side, from vendor point of view, a vendor to a customer, we have to be transparent in terms of technology components that are used in SBOM. We have to guide our customers into the secure deployment of software in their environment. We have to constantly look at patching. So security patching for software, for operating systems, it has to be constant part of the process. And there needs to be a collaboration and agreement and understanding that as security patches are coming out, they need to implement them. They need to install them to harden their system, to protect their systems from known vulnerabilities. We, as a vendor, also have to listen and look at it from their point of view, their architecture, their network, and understand how we can help them better. And if they're running into any kind of potential cybersecurity event, then we have to help them to make sure that the critical patient care is continued undisturbed. Our customers' trust in our focus of cybersecurity is also validated by the certifications. So certifications are another means of establishing that trigger and sort of holding ourselves accountable to that practice and establish trust with each other. So for us, it's the Sensinet Transparency Secure certification. The FDA had recently introduced very rigorous cybersecurity guidance, and our products have accomplished that certification, and the rest of our products are also going through that same rigorous exercise. And likewise, the SOC 2 type 2 for security is another avenue through which we can establish that trust not only at the security of the technology components and software, but also of the process. That is very important part of the overall process. So this is a way to establish 360 degrees of product security from pre-market to post-market and supplier management and engaging with customers. That's very important to establish at the product level and build that strong security posture for the ecosystem to be strong. Thank you for your time. Shah, I'll turn it over to you.
All right. So now we have some time for question and answer, which is great. We've got a few questions coming in from the audience. One is maybe not so much a question, but a rejoinder of agreement with Dr. Chopra. One participant has said, spot on with communication. Seems it would be a little easier for a utility or a company with a fixed customer base to communicate. We should all work together to identify the best way to communicate with our communities. Any comments? I think it's a great rejoinder to the basically the punchline that Dr. Chopra gave us all.
I'll jump in, and I totally agree. I think the difficult part is to create the framework, right? I don't know if we've really thought about it the way these other companies have thought about it before and spent the time beforehand. And you know, there's a lot of legal issues associated with this, which we didn't touch on, right? What can we say without putting our company at risk? Those are things that people don't, that people think about constantly. And the person who wants the communication probably isn't, because they're going through a difficult time. And that's why we have to strategize early and often before the event occurs, so that we have a clear pathway internally that we can, that the person externally who's being affected by this can have confidence in that we have, that we're doing what we need to do to support them. So yeah, totally agree. I think, you know, utility companies probably do have it easier, and, you know, maybe airlines are closer to what we have because their problems are more fluid. But at the end of the day, we have to have a plan. And right now, I don't know if we really do have a great one. We certainly are working on it internally. It is an area of focus for us.
Thanks, Raj. That's great. Anybody else have any comments on that one? All right, another question that came in from the audience is, this is interesting, any word from the field about malicious code embedded in imaging metadata? I think it's low likelihood right now, but potentially catastrophic. Does anybody have any information about that?
Well, I'll go first, and maybe Nilesh will add to that, right? At least from my perspective, we do know about such risks and vulnerabilities in some of these standards, and how information moves back and forth, and especially getting into the metadata and imaging, especially like in DICOM. We are aware of some known vulnerabilities in that space, right? And we look at that and evaluate it. But from an enterprise level, I'm always looking at the different levels of security we have in place to first protect against how to get it there in the first place. And this is why these endpoint detection and response solutions that we use and have on all of our assets to ensure that any interesting or odd behavior as to how do you get that malicious code injected into that metadata in the first place, we block and prevent against. And that gets back to, I'm looking at that chart previously, training, awareness, you know, preventing people from getting phished into loading something on their system. And then we'd really have to be complex, right, to really know that you're targeted and you're going to try and inject malicious code or malware into these imaging solutions, right? And then again, how does it, you know, get viewed on or handled within our products themselves? I know that as we've looked at this, our tools do strip or mask out any of these type of areas where code could live to make sure they couldn't execute on the client end of things. And Nilesh, I don't know if you had anything to add to monitoring that across our products.
Yeah, no, this is an interesting problem. Most of the standards, such as DICOM, leave some room for interpretation, and different customers, different entities interpret them separately on their own and use them as they see fit. That usually leads into potential of not being able to apply some kind of strict standard of validation of the data stream coming in, because you have to allow exceptions to what somebody might be incorporating into the data stream that they need. So part of the problem, I think, as a community, as an industry, we need to get better at not taking loose interpretation of the standard. That's one aspect that we can work towards as a community. And the second thing we can really try to do is be aware that this might be happening and start looking at potential ways. And this is something the standards committee can really work on. And I'm sure they are working, and they need to do a little bit more work towards that. Is, what are the tools that can be used to look for the malicious patterns in the data feed and try to prevent them. So at the product level, we do have the ability that can be used to do validations, but it's challenging unless the industry really comes together and defines how to use the standard in a way that prevents openness of malicious code getting into the standard data.
Great, thank you for that. And there's yet another question. What is the plan going forward with OS approved updates? Not sure about that one.
Well, I'll just speak to, I've observed this for many years, right? And I know I've seen many cycles of how to address this, how to let our customer base know that it's safe to apply Windows patches, either through communications, websites. It can be quite different depending on which of the merge solutions that you have. And again, I'll defer to Lesh on some of this activity and what we do within our testing environments, but, really to hit that point where all OS updates, right? How quickly can we automate and test our own solutions in-house to make sure there's no known effects to them and get that message out to you? I've seen over the years that ebb and flow as to, we're really good at it, and sometimes we lag behind depending on the OS, the platform, and the structure. So it's a bit of a mix, and I get it. That is a challenge, even for us just on enterprise, right? Sometimes folks just aren't prepared to put that latest Microsoft patch on from that Tuesday that it comes out, because in the next few days you find out, does it break things across the industry, not just in healthcare, right? So there's always a little bit of delay on what we look at that too. So I get it, I understand that, and we always try to make that better.
Great. And another one came in. Oh, sorry, Lesh, do you have something to add?
I just wanted to add that at the product level, we do look at patches as they become available every month. We internally test them and apply them. We have developed the test suite for the functionality of product validation, and we have a formal RAQA process, QMS defined process for validation of our product with the operating system patches. But to Scott's point, a specific customer's configuration at their level, at their systems might be different, and sometimes even big companies like Microsoft or Apple or whoever, right? They make mistakes too. So it's something that is best done in layers, where us as vendor, we take responsibility of validating and provide the patches, and then the customers can and should do the testing in a test environment for validation in their system before applying it to the production. And we even build resiliency in the production system, where should something go wrong, we have the ability to fail over quickly. So those are some of the ways you can build layers of protection, but nothing is perfect, right?
Mm-hmm. Okay, there's another question that came in about handling vendors. Have you found any specific tools or platforms that have helped streamline things in managing vendor security?
I think it's still a challenge because there's so many different tools out there, right, for our customer base and how they want to assess us. So I really like the standard, hey, do you have a SOC 2 for the environment that we're going to have our data in? Best practice, and usually if we can exchange that and it solves in third-party risk management, it's great. Same with ISO certs, right? But sometimes that's not good enough. Or maybe they're looking at, a different part of our business. We might not have a SOC. And then they send, a set of security questionnaires. could be a spreadsheet. Sometimes they're using a third-party tool, right? It can be quite cumbersome for us to manage that as well. And I still don't see how the industry is going to be able to solve one single point to do this. And I think that's why all these security risk services are turning up. This is how I do it with our vendors, right? SOC 2, high trust, ISO, and MAR vendors. Great. That's a pretty quick checkbox for me to assure they have a good security program in place. If they don't have that, well, now they're going to have to answer a bunch of our security questions, right? I have to figure out, do I have to mitigate anything they're doing? And larger vendors, they might not want to answer our questions, right? They're going to ignore us. Then I have to go back to these security risk services. Well, what does the scoring tell us? And I'll always look at multiple vendors like BitSight, Risk Recon, and several others to see, are their overall scores good? Because sometimes I'm just going to have to trust a third party on this. So it is a bit of a challenge. We try to do our best in our response, especially it's when it's turning around SOC 2. So sometimes we really do have to answer a lot of detailed questionnaires and sort through the scope. Are you asking about Scott and the enterprise, or asking about the product that you're going to buy? It's still a bit of a challenge. I don't have any to recommend other than leveraging that multi-layer approach that I described, right? Starting some of the industry, strong ones that we use, SOC 2, high trust, and ISO. And then from there, it can be a little bit all over, but sometimes you have to use multiple to really achieve what you're looking for.
Excellent. Okay, so now we have another question for the clinical expert here. How do cyber attacks impact interactions between clinicians who are inside versus outside the affected hospital's organization, such as referring physicians, and how should hospitals prepare?
That's a good question. I mean, we kind of touched on this topic during the talk, but we're all interconnected at this point. I may be doing the imaging, but the surgery is being done at a different hospital. I may be doing the imaging, but the primary care physician is across the state. And our contracts, with teleradiology, especially, the interconnectedness is incredible, right? And if I'm not performing, then they can't do what they need to do patient care. So, how to prepare on the other side of it is to make sure that you have trust in each other, right? And when I go back to that communication strategy and we talk about trust, we as the radiologist sitting in the middle between the physicians on one side and the vendor community that's providing the service that's being under attack, we need to trust them, the people who are providing the PACS or the EMR or whatever electronic information that we use. And the people on the other side, the people who are getting the information from us, need to trust us. So it means that you do have to be prepared. You need to have those conversations before the event occurs. You need to know what you will do when that happens, because it will happen, as I mentioned before. So it's more of a, airing out the laundry, having the discussion before, not in a time of panic, where trust completely breaks down. By preparing, there's things that we do internally, right, to mitigate as a company, not as a radiologist, but as a company, or that we do. We talk about our failovers, and we talk about our processes to vendor manage. We talk about what we do on a day-to-day basis to be a good vendor to the community. I think the same kind of conversations need to happen between radiology departments and hospital systems to say, hey, when we have downtimes, what are we going to do? What are the processes in place? In our hospital system, we definitely do that so that you can continue to do as much patient care as possible. So the only thing you really can do is communicate before it happens.
Great. Okay, and then another question that has come in. This one's directed specifically at Scott. This is going to be probably our last question, given the time we have. What are some of the customer concerns your team is addressing?
Well, it goes back again to the supplier management stuff, right? And how they ask us through these questions and scoping. If I think of specifics, though, I do see a lot of interest in how we are applying encryption, right? And I'll just speak across Merative what we see, right? It's the same stuff when it gets to security, encryption, key management. How well are you protecting their data, how are you protecting their data against or separating it from others? That's one of the key areas. And obviously, there's always a great interest in when it's cloud platforms, how do you secure that? What does your security testing and pen test results look like? Those are a lot of key concerns. And then from there, it starts to get into identity and access management functions. How well can we support multi-factor authentication or single sign and all these other factors. So I think those are the two, key areas I see. And of course, the questions on, do you have SOC or, some of those standards that we can share with them. And sometimes it's not against the business or against the product, it's against the business. So we're working on, putting that together as well to make sure we always have what they're looking for.
Okay. And then a last and final question for maybe everybody, but I think, Raj, for you first. Which function or department within a health system is best suited to drive preparations for a cyber attack?
Well, I mean, it has to be the IT folks. I mean, they know it better than I ever will know it, right? I'm a practicing radiologist. Half the terms and the acronyms that are out there, I have no understanding of. For me, going back to the utility analogy, for me, cybersecurity and IT and all those things are a tool that I use to do patient care. I just want it to work. As long as it's working, I don't think about it. It's just like the power being on, right? As long as the power comes on, I don't think about it, but I think about it and I get frustrated with it when things break. So the IT professionals have to be the ones that are making sure that I'm functioning so I can provide the care that my patients need and that my clinical colleagues need. So I would say they were.
Scott, any reaction to that question? Which function or department within the health system is best suited to drive preparations?
Well, that's interesting. Dr. Chopra was talking about when things break. There was a recent event last year when it actually was security that broke things, right? This is the CrowdStrike issue. If you're talking about the Southwest dilemma, right? Remember the Delta issue where CrowdStrike on any Windows system was doing blue screens. I happened to be traveling then, and there was blue screens throughout the airport, right? That was a security tool that broke things. It's a combination between security and IT, right? Them working together to know what the security tools are doing, the IT team is doing, and how they implement, and how they can respond. They have to collaborate. It's equal between those two, that it's important that they work close and together, especially in doing tabletop exercises like we do with our IT and ops team. We need to learn what their systems are doing so we can monitor them best. And obviously, right, making sure security tools aren't interrupting, the services that IT is providing.
Thank you. And Nilesh, what about you? Any thoughts on that question?
Yeah, it's such an interesting question. My first observation a while ago was really that when it's not a clearly defined responsibility, it falls down in a lot of ways where somebody thinks, well, IT should do it. And within IT also somebody might say, well, it's this guy, it's the security team's responsibility or the product team's responsibility. So I think it's a great question to address. And it starts with defining a proper RACI metric of where the responsibilities lie. If you have an organization for quality management, they may be a great starting point to lead the process definition, but it has to come together with the IT organization, the security organization, the product organization. And if you have a clinical staff of end users like Dr. Chopra, then you have to bring them into. But that's the important aspect, that you have to define a committee of sort who has the responsibility of defining the process and managing it through and revising it. So the best thing I can say is my experience has shown if you have a quality management program in the organization, that may be a great place to work through this. But it's very important that a well-defined RACI is built and managed.
Perfect. Thank you so much for your time today to share your viewpoints, and thank you to those who attended. I think we should close the session now, and as I mentioned at the beginning, there will be a recording available in 24 to 48 hours. A follow-up message will be coming to you. Again, thank you so much, presenters, for your time and your thought to prepare for today, and have a good rest of your week.
Thank you, everyone.